We're really not asking you to change your clinical approach to patients. What we're really talking about is better informing the decisions you already make. Because if you think about what we do in the ICU, or in the ICU, in the OR, the ED, we're managing patients' perfusion and blood pressure and making sure that patients are stable and doing well. The first decision there is, do I have a perfusion problem? We can help with that. In addition to blood pressure, as we talked about before, cardiac output adds something to blood pressure, lets you see the physiology underneath blood pressure. But then, if you do have a perfusion problem, typically our first go-to agent is we give fluid first.
Sure.
Okay? What we're really talking about now is we can help you see whether or not fluid is effective, whether or not fluid is getting you what you want it to do. And that's important because the literature is showing us half the time it's not working in that
Right.
regard. And what we also know is that volume overload and giving too much fluid is also problematic. And as I said earlier, this ability to sort of load them up now and take it off later, yeah, that doesn't work so well. That has mortality implications. It has complications that I think we tend to discount a little bit. So what we're really talking about is fluid effective. If fluid is not effective at getting your perfusion fixed, then typically we move on to pressors. And we can help you here with vascular resistance and looking at the impact of your pressors. And then, of course, if your cardiac output is low for some reason, ionotropes or other therapies directed at contractility can work as well. So we really help inform all of those decisions as you
Right.
move through that. But those are decisions that we're making every day at the bedside, in the ICU, in the ED, and the OR. So we're really talking about how do we better inform those decisions. It's not really making anything different. It's really about better information.
It's really enhancing and
Yes.
giving a window into the heart that we couldn't see before.
Exactly.